I'm the Senior Director of Population Health at the Health Federation of Philadelphia, which is a public health nonprofit based in Philadelphia. And we run a health center controlled network that encompasses many of the health centers in Pennsylvania, though certainly not all. So currently we're working with about 18 health centers on this project. We also do a lot of other work, other public health work, training. We run some direct service programs, but primarily we're there to support and help the health centers network and learn and advance. Most of the health centers we were working with had gone through an EHR implementation. Some of them had gone through more than one EHR implementation. But they were realizing that they were putting all of this information into the EHR and they really weren't able to get out what they needed, which was real actionable data, as well as reporting for all of their funders and the folks setting requirements and the government. So that was really the problem we were trying to solve with them. I think the other issue that I'm not sure if we really knew that this was going to happen before we implemented, but it certainly kind of post facto has come up as a problem that we have helped to solve. We work with health centers who work with a number of different EHRs, and we certainly try to support their use of those EHRs as part of our work with them. But what TRACS has really given us is a common language across all of those health centers and a common platform where we can engage and really support each other, which we don't have in the EHR itself because there's that fragmentation. Getting data was just very, very difficult. And if the health centers could do it at all, they were outsourcing it to someone who was developing reports that were completely inflexible in terms of the criteria. So if a measure changed or they needed something a little bit different, they didn't have the power to kind of tweak that and customize it and make it be what they needed. They were kind of stuck with an annual look at their quality measures even. They often couldn't look at measures by provider or sometimes even by site. So there was really a lack of data, and there's certainly, around things like practice transformation and team-based care and patient-centered medical home, we really didn't have the tools to underlie those processes that would provide the care teams with actionable data when they needed it and without a tremendous amount of pain and suffering, basically. It really just is tremendously empowering to them in terms of the data that they now have at their fingertips. As long as we can get them, with eye-to-eye support, really get them implemented right, get their data in pretty good shape. There's so many different tools that they now have. They have really flexible reporting that they can look at by provider, by site, by different time periods, different populations, and they can use that. The huddle sheets in and of themselves are pretty revolutionary, and that's really a process that we've enjoyed seeing spread across the health centers. I think when we first started with TRACS, there was a lot of sense that this was something that was going to live in the quality department, that maybe the medical director or the quality manager would have sort of sole control of this tool. And what we've seen and really pushed through implementation is we've really seen the tool move out to many, many layers of staff within the organization. So there are MAs who are using it, there are care managers who are using it, there are individual providers who are using it, and folks are really discovering the potential there that all of this data that they can use to make their care more efficient, more timely, to address some of the care gaps and quality issues, in a very everyday, on the ground kind of way. It's really been exciting to see and to help support the health centers as they discover the full potential of the tool and realize that it is so much more than a reporting tool. We just have really loved seeing them grow in their ability to use data and their trust in the data and their pride in their quality improvement work that they do. And I think so much of that is really enabled by these tools and by the mastery of these tools, and the way that they're really, these are not IT people, and that's excellent. That's perfect. They're quality improvement nurses and performance improvement coordinators, and they're just so, they know their data and they believe their data, and they become these kind of evangelists with their providers around, around the tools and around the data, and it really, it's very exciting. It's really, it's very rewarding from my place at the network to see that process develop.